From our 22 News Broadcast Center, this is 22 News in Focus.
Good afternoon and welcome to 22 News in Focus. I'm Ciara Speller. May is National Stroke Awareness Month, and according to the National Institute of Neurological Disorders and Stroke, there are more than 800,000 strokes reported annually in the United States. Strokes are a leading cause of death and long-term disability, especially among people over the age of 65. So today on 22 News in Focus, we'll be discussing what causes a stroke, the most current technology for treatment, and aftercare. Joining me now is Dr. Gottfried Schlag, a neurologist and vice chair for research for the Department of Neuroscience at Bay State Health. We thank you so much for being on the program with us today.
Thank you for inviting us.
So I just want to start with some background. Let's have you talk about what is a stroke and how is that caused?
Sure. So a stroke actually comes from the Greek word apoplexia, which was first described several hundred years before Christ was born. And it meant a sudden change in your neurological status. In general, we think of stroke as basically a disease of blood vessels, and there are two types. One is an occlusion of blood vessels that causes subsequently a lack of blood flow, a lack of function, or a leakage or rupture of blood vessels that can cause a bleeding into the brain tissue.
And so there are different scale levels as well for stroke. Could you talk a little bit about that for us?
Yeah, again, it's sort of like related to the size of the blood vessel. There are small, medium, and large blood vessels. Small blood vessels are mostly affected by high blood pressure, and exposing these small blood vessels to high blood pressure sort of like leads to a remodeling of these blood vessels, and that can actually then lead to a closing of these blood vessels. Medium and large blood vessels are mainly affected by calcification, inflammation, and lipid deposition into the walls of blood vessels, and that can lead to a closure of blood vessels. And then there are other types that have to do with blood clots that come from the heart or from the vessels in the neck and can also close the blood vessel.
And so there's another term that I want to mention, aneurysm.
Yes.
So is a stroke the same as an aneurysm?
It could potentially be, if we go back to that original meaning of the word stroke, that it is an apoplexia. It can potentially lead to a sudden change in your neurological status. But an aneurysm is like really, again, a disease of the blood vessel where there is a bulging or widening of a blood vessel that can be detected incidentally if somebody is being scanned, even though they're not really complaining of an aneurysm, or it can be something that is actually symptomatic because it leaks blood and causes all kinds of other symptoms.
And so signs of stroke can be different in different people, but what are some of the common ones that people should really look out for?
That's a good question. So I usually define a stroke as meaning that there is a sudden onset of neurological symptoms that can either be lateralized or localized. And it can sometimes be associated with headaches, but almost always it happens in patients that actually have risk factors for a stroke. So if one follows that definition and looks for risk factors for a stroke, I think one has a very high sensitivity of making the right diagnosis. And strokes can present with signs and symptoms that are related to loss of motor function, loss of language functions, impairment of visual fields, as well as being inattentive to one side of the body, which are sort of like all the major stroke symptoms that there are.
And so there's an acronym, a four-letter acronym, FAST, FAST. What does that stand for? It's something that I remember my family members telling me as a child. So for our viewers.
Yes, so FAST stands for facial droop, arm weakness, speech impairment, and time. It is an acronym that was basically coined by the National Stroke Association and the American Heart Association, and it's really to educate the public about what are stroke signs, what are stroke symptoms, and what do I do if I have or if I notice somebody having these symptoms. And time really means that we have to treat this as an emergency, and we should call 911 to sort of like get to the hospital immediately and sort of like perceive the treatments that we have now available for patients.
Yeah, and why is it so important to seek immediate medical attention if you do believe that you or a family member is suffering a stroke? As somebody who had a loved one that suffered a stroke, we got them to the hospital right in time, and they were able to give them something actually that kind of paused everything from progressing. Could you talk about that?
Yes. So the easiest answer to this is that time is brain. The longer that it takes from the onset of symptoms to actually receiving care, the more likely it is that the damage or that the brain cells are dying, and that has been well established. We also have treatments available right now that can be clot-busting medications, for example, that we have to give within a certain period of time, so not to have any additional complications when we give these medications. And it has been studied that the earlier we give these treatments, the more likely it is that we will have a benefit from it. There are other treatments that we can do, extracting a blood clot or potentially having to do surgery. Almost all of them work better and have better outcomes the earlier we can actually do this from onset time.
And so once somebody arrives to the hospital, walk us through some of the diagnostic testing that they might, go through.
Yeah, that's a good one. So we are trying to assess these patients as quick as possible, which usually involves doing a very quick neurological exam, trying to figure out what the history is, trying to figure out whether or not they have risk factors for stroke. Then they usually go to a CAT scanner, which has two components. One is just an assessment of their brain tissue, and another one is an assessment of their blood vessels, both in the neck as well as in the brain. And the CAT scanner assessment of the brain tissue is more like trying to exclude other possible things. So we can actually use this to exclude a bleeding or other causes that would look similar to a stroke. CAT scans are not as sensitive as MRIs in actually showing a positive diagnosis of stroke. The CTA, or the blood vessel study, is extremely sensitive and is very good to actually tell us whether or not there are blood vessels that are narrowed or blood vessels that are closed off, which then helps us making a diagnosis and figuring out what treatment options there are.
Yeah, and I want to ask you, are strokes preventable? There are some risk factors. They could even be family history, but, what steps can people take?
So there is what we call primary and secondary prevention. So primary prevention is if we are trying to prevent that anybody has a stroke in the first place. So again, it's identification of risk factors for stroke, treatment of these risk factors, reduction of these risk factors. Secondary prevention is really if anybody had a stroke, how do we address now these risk factors? How do we treat them? What is the best option to prevent another stroke from happening?
Okay, and Dr. Schlag, we're going to take a quick break, and then once we return, we'll continue our conversation. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today's topic is stroke awareness. We're continuing our conversation with Dr. Gottfried Schlag, a neurologist at Bay State Health. So I want to have you quickly talk about strokes that are being seen in people in their 20s and 30s. Over recent years, it's become more common, and it's really a startling statistic. So can I have you talk about that?
Yes, so it's still an observation that we are making, and we're trying to understand this ourselves, why we're seeing this slight uptick. I think it has something to do with still the amount of risk factors that are out there, but it's also potentially related to increased drug use. For example, cocaine is a substance that is associated both with causing closure of blood vessel as well as bleeding directly into the brain. And then there are sometimes hereditary or genetic predispositions there may be heart abnormalities, or there may be people that are on combination of medications already in their early age that would potentially increase their risk for strokes.
Okay, and I want to have you talk about some other terminology here. CT scan, something that we often hear, but what exactly is that?
So CT scanning is an X-ray technique that uses small, narrow beams of X-rays that go through an organ, and there are detectors on the other side, and it can basically very rapidly scan an entire organ or the entire head to get good structural images. We mainly use it to rule out a bleeding, but we can also use it to see some of the early stroke signs. And then a CTA is a technique where we give contrast, and the contrast basically lines up from the inside all of the blood vessels, and we can beautifully see the blood vessels in the neck as well as all the blood vessels in the head.
And so how does an MRI differ from a CT scan?
So an MRI, the main difference is it is not a X-ray technique. It basically has no radiation exposure at all, but it takes usually longer, and the preparation for an MRI is longer because we have to make sure that somebody doesn't have any metallic, electronic implants in their body, or any kind of injuries where metal could have been exposed or could have gotten into their body, because that would be dangerous. An MRI is a combination of very strong magnets, and of course if there would be an electronic or magnetic or metallic part somewhere loose in the body, that patient would potentially be at risk. MRI has, compared to CAT scan, the advantage that it allows us to make a positive diagnosis of stroke. We can actually see a stroke within a few minutes light up as an abnormal signal on the MRI. So that's its greatest advantage compared to CAT scanning, but it takes longer, is a little bit more cumbersome. We usually do MRIs after 1, 2, or 3 days when somebody comes in with a stroke, because it gives us a really good estimate of the size of the stroke and where the stroke is located in relation to really important vital functions of the brain.
And in terms of technology and advancements, what other imaging tests can be used or are currently being used?
So one of the methods that we have is called CT perfusion, which is again we giving contrast and then scan the brain with a very high time resolution while this contrast goes through the brain. And CT perfusion is mainly used to identify regions of the brain that are at risk for infarction but have not infarcted yet. We call this the penumbra, and that would allow us to gear some of our intervention towards those patients that have that characteristic, that have tissue that is at risk but has not infarcted yet. And if we can salvage that tissue, we can make a big difference for that patient.
And what about a blood test? Would that be useful at all in somebody?
Yes, every patient actually will get blood tests. We usually look for their sugar levels. There's a protein that tells us something about how their sugars have been over the last 3 months. We look at somebody's cholesterol and other lipids in their blood. We look at signs of inflammation. We look at renal functions, as well as a lot of other tests that tell us something about how likely it is that a patient will actually form blood clots. And all of this can be factored in to understand what is the reason that this patient in front of us had a stroke, and what is the most appropriate treatment for this patient.
And how about a EKG? Is that something that would be used as well?
Yes, almost everybody gets an EKG right from the beginning, and then they will be monitored on a cardiac monitor for as long as they're in the hospital. And an EKG looks at the rate and the rhythm of the heart. And for example, patients who have irregular rhythms, such as an atrial fibrillation, are at much higher risk of actually forming blood clots, and potentially these blood clots could travel to the brain and could cause a stroke.
And so in the last segment, we briefly touched upon, medication that might be administered to help prevent a stroke, but let's talk a little bit about that. What are the types of medications we're seeing?
So there are probably 5 different kinds of medications that we currently use. So one type is medications that we do in order to dissolve a blood clot. And those are sometimes medication that we can give into a vein, sometimes they're directly injected into a blood vessel. They have a high affinity to detect blood clots and can potentially solve them. Then with regard to secondary prevention, we can put patients on aspirin or similar medications to prevent sort of like the clumping of platelets in the blood. We can also put patients on blood thinning medications such as warfarin or apixaban to prevent the formation of blood clots. And then there's a whole slew of other medications that we have to consider, such as medications to treat high cholesterol, to treat high blood pressure, or to treat their diabetes.
And how about clinical trials? What does that look like right now?
That's a good question, and I really want to make a pitch for clinical trials for every patient that comes to the hospital to ask about clinical trials, because we have so many new and novel clinical trials right now, for example, that we are running at Bay State, that really offer the most advanced intervention, the most advanced treatment, as well as the most advanced secondary prevention that we can offer to patients, and it's a very valuable thing to being considered for these trials.
And let's talk about recovery from stroke. What are the chances that somebody will make a full recovery? What kind of happens after?
Yeah. About 50 to 60% of patients after a stroke, when one looks at them, for example, at 3 months, have an incomplete recovery. And that incomplete recovery frequently is something that actually impairs function enough that they may not be able to pursue all of the activities that they did before their stroke. Frequently, we are confronted with whether or not we can predict in the acute stroke phase where somebody is going to end up in 3 months, particularly patients that are really severely impaired. The patient or their relatives or their caregiver want to know, what are their chances of recovery? What are their chances of an independent life? And current technology, in particular the use of MRI and where the lesion is, really allows us to make these kinds of predictions of what might happen, what is supposed to happen, how does somebody recover, and can we actually predict this recovery. And then I think in one of the next sections, there are interventions that one can do, very intense physical, occupational, and speech therapy that can be done. And these interventions can be combined with other novel treatments to enhance and facilitate a patient's recovery. And it's an increased emphasis now that both the federal government has realized, as well as other funding agencies, to think of stroke recovery as sort of like the new frontiers in clinical neuroscience to enhance somebody's ability to recover from an impairment.
Okay, Dr. Schlag, thank you. Very important information. We appreciate it. Rehabilitation is an essential part of stroke recovery. We'll find out what types of therapy are needed after a short break. You're watching 22 News in Focus. Welcome back now to 22 News in Focus. Today we're talking about May being Stroke Awareness Month, and we're learning about the diagnosis, treatment, and recovery options. Joining me now to discuss recovery is Michelle Lantain, an occupational therapist with Bay State Rehabilitation Care. Michelle, we thank you so much for being on the program.
Thank you for having me.
So it can take weeks, months, or even years to recover from a stroke, right? And some people recover fully while others have long-term or lifelong disabilities. What is the assessment process when a stroke patient comes in for rehab services?
Oh, well, Stroke assessments start immediately. When a patient's in the hospital, the first people that get a patient up is usually the nurses and our physical therapy staff and our occupational therapy staff. So we are immediately assessing patients whether they can roll in bed, sit up in bed, stand up, get out, move around a little bit. And that's usually right from the beginning what we do is really moving the patients. From there, a speech therapist will sometimes come in and work on swallowing and sometimes cognitive therapy to see if people's memory is okay. And as an occupational therapist, what I immediately start doing with patients is I work on what we need to do to get us back to our daily living skills. Sitting up in bed, getting dressed, reaching down, getting your socks and shoes on, taking a shower, washing your face. So that starts immediately, whether it's be in the hospital or even in outpatient services.
And do you have a team approach, who would be on the team?
Absolutely. So in our team, we work with physical therapists, occupational therapists, speech therapists. In some facilities, they have a case manager working with them. But of course, then you have your medical staff working with you, your neurologists, physiatrists, physicians. We all try to communicate together and form a plan for our patients.
And what kind of physical activities are involved in rehab? Like you mentioned, swallowing. So somebody might have a feeding tube because they, don't have the ability to now chew food for themselves. And, so what are some of the activities that people would be doing?
Certainly everybody's very individual. If someone's working on things like swallowing, sometimes your speech therapist will work on that with you, whether it be to thicken some liquids, to work on oral motor skills and strengthening in your throat and in your cheeks. As an occupational therapist, we practice those activities that you need to do every day. So we'll practice you getting dressed. We'll practice you reaching for the cabinet, opening up things, working on some fine motor skills. And of course, in physical therapy, it kind of goes with that physical component. You're getting up, you're moving, you're walking, you're learning to use a walker or a cane, or just learning to use your muscles back over again. So it's a lot of exercise.
And how about for cognitive and communication abilities?
Awesome. So cognitive therapy is so important in stroke recovery. Our executive functioning skills really work on how we are able to plan things, pay attention, manage our finances, memorize things, work your calendars, and go back to work. So there is a variety of therapy that we do to train those specific deficits so people can get back to what they need to do every day.
And so somebody might search, what kind of alternative therapies could I be doing, like massage or acupuncture, acupressure? Does any of that stuff work?
I think it's certainly an individual assessment. So any patients that tend to have a lot of pain, some patients really benefit from acupuncture or acupressure, and it's worth discussing that with your doctors every day to see if there's something that you can do to help speed up your recovery and some of the process. I think anything you do to focus on promoting your body's abilities again are a great thing.
Right, and so there are different stroke levels, right? A massive stroke, a minor stroke. When should therapy begin after these?
Immediately. Therapy starts the minute you can start to participate, and that's even if you're in bed and you can't move an arm or a leg, you should start trying to move immediately. In our hospitals, we have therapists coming in to provide range of motion. If you have the ability after you leave the hospital to go to acute rehabilitation or a skilled nursing facility or participate in home care, and even going into outpatient if you're well enough to go home after that, we should start therapy immediately, because the more that we're able to stimulate those areas that have a deficit, the more your brain will remember how to use those parts of your body again.
And we briefly talked about it a little bit earlier, but just in case we have viewers who are just joining us now, in terms of daily living, what sort of activities and services do you offer to get back to dressing yourself, to just walking your dog, those type of things?
Well, that's my job. So as an occupational therapist, I focus on all the activities of daily living. I work on being able to get dressed, take a shower, clean up your house, reach for the cabinets, fold your laundry. That's what we do in occupational therapy. And what we can do is either design some compensatory strategies if you have an area that you are really struggling with, or we practice those activities until those muscles get stronger so you can regain that motion.
And what about adaptive strategies when physical or mental limitations can't be corrected?
That's another great way that rehab can help you. We can focus on designing specific things for those patients who have deficits that will help them be as independent as possible. Sometimes that involves educating caregivers. Sometimes that involves using assistive devices or different ways of doing those strategies. And that's what your therapy team works with you for.
And how about, how rehab services are offered? Can it be in-home? Can it be at a long-term care facility? What are the options?
There are so many different options these days. Once you're in the hospital, your therapists come into the hospital to assess how you're moving, and they immediately are starting to formulate what type of rehab you need next. So based on those recommendations, some patients receive acute rehabilitation at a center where they would go and have intense rehabilitation about 3 hours a day. Some patients qualify for skilled nursing facilities where it takes a little bit more time for them to regain some function, move a little bit more, medically stabilize. There is also home care services. There's a variety of businesses that offer that, as well as basic VNA services. And if patients are able to go home and are like a higher functioning patient, they will often have outpatient rehabilitation care services. And that's what we do in our outpatient services.
And so you have, like your medical care team, but then you also have your family that becomes a care team as well. So what are, some of the services offered to them to help those loved ones?
Well, our care partners are part of the rehab team from the get-go. So immediately, their caregivers should be involved with their patients in their care and what we're doing to make them more independent. So they should be there for the education. They should be there for all of the training and the new techniques that we're learning at that time. So we will often spend many sessions working on that with them.
Yeah, and so someone, might have suffered a stroke and they think that, they can just get through it themselves, they can do it on their own. What would you say about, getting the rehab help?
I would say, continue to have that passion to really do things for yourself, but get the help. You have a short amount of time where you can really work on those things before our bodies take over, and it's called like a learned disuse. We stop doing things the way we used to because our brain doesn't remember how it worked. And they have these strategies that people start to do that aren't the best. You might be able to rehab and get a little bit better. So I think it's the best thing to do is to look towards having some therapy services as early as possible.
And how can people learn more about the services and therapies that are available?
Absolutely. You could speak to your primary care doctor. They will often make referrals to therapy services. You could also look things up on your own, a local therapy near you. Of course, all the websites will have that where you might be able to qualify. You can also call your insurance companies to see what kind of therapy services they will cover for you.
And so Dr. Schlag and I had talked a little bit about younger people having stroke as well. So
absolutely.
Younger people can receive these services too.
Absolutely. You don't have to, strokes don't happen to just older individuals. They happen to people of a variety of ages. And everyone ends up with a variety of different kinds of deficits. So absolutely seek the services. Just because you're younger doesn't mean you wouldn't benefit from having that extra care.
And how long, is the average recovery and therapy? And
absolutely. So therapy can last quite a bit of time. It all, of course, depends on the type of deficit a person has. But I would say the average person has about 3 months of outpatient therapy. That's only after they've already gotten home. So usually after a stroke, if someone has a profound deficit, they can end up being in a skilled nursing facility or in rehab. It might take a little bit longer, so that could be an additional 3 months. So you're rehabbing at least 6 months. And that doesn't mean you're done after those 6 months. Our bodies are continuing to heal. Our brains are amazing things. So continuing to work on those things beyond that time is really important. So even if patients have had a stroke a year or two previously, sometimes they come in for tune-ups. It's important to work on those muscles and those skills to continue to make yourself stronger and to work on those things that you haven't been able to do before.
All right, Michelle, great conversation. Thank you so much.
Thank you.
Stroke survivors can experience emotional and behavioral changes. And when we return, we'll be talking about mental health resources for stroke recovery for both patients and caregivers. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about diagnosis, treatment, and recovery options after a stroke. Joining me now to discuss the mental health impact to patients and their caregivers is Melissa Perry, Health Integration Manager at River Valley Counseling Center. We thank you for being here with us, Melissa.
My pleasure.
So stroke impacts the brain and can cause damage both physically and mentally. Family and friends sometimes report personality changes, from somebody that's recovering from a stroke. It could be that they're a little bit angrier. It could be anxiety anxiety, forgetfulness, confusion. So why should someone recovering from a stroke and their family or caregiver seek counseling?
Really, the stroke is catastrophic to somebody, both mentally and physically. Their life has changed overnight. They are not capable a lot of times of being able to do the things that they were able to do in the past. For instance, walk or, do their bills or grocery shop. And a lot of times people within their lives actually have to jump in and help. I'm actually going through this personally right now with a family member who had a stroke in November and is now at home and has had a lot of losses, and it's very, very hard to watch her. And, this is somebody that used to walk Look Park 3 times a day and was very independent and did, all her shopping, all of her bills. She was a retired RN. And like I said, it's very hard to watch all the changes. And so I think that, if you're struggling with mental health issues after a stroke, talking to your primary care physician and seeking help through the primary care physician, oftentimes they're willing to prescribe medications and also refer to outside agencies for therapy. River Valley has therapists that work with, all sorts of patients with mental health issues. A lot of patients with stroke, suffer with depression, suffer with anxiety. They're very frustrated. They talk a lot about loss of control of their life, which they have. They need assistance with a lot of things. And might need medication management as well as talk therapy, and may need to see a therapist for cognitive behavioral health therapy or mindfulness therapy, sometimes art therapy, sometimes music therapy. The other thing that's really helpful, and we're doing a series of talks at the Holyoke Senior Center this month is very helpful, is support groups. Now there's a support group at the Holyoke Senior Center, there's support groups in Springfield, support groups in Amherst, and it's really helpful for the patient to be able to talk to somebody and for the caregivers to talk to people who have gone through this kind of experience and understand what's going on with them, and it's comforting to those folks.
I can attest to everything you just mentioned as somebody who had a loved one that suffered a stroke as well, and it can change family dynamics too.
Absolutely.
So, talk about some of the things that could happen.
So this very strong, independent person who did all of her bills, is now relying on myself and my sister to take over kind of all of those things, to get her lawn mowed, to make sure her house is clean, and it's really hard actually, because, being a caregiver and having my own household, now taking care of another household, and taking care of her and, trying to find people to help us with her. I mean, it's a lot. It really does change all of the family dynamics. And again, that person has lost their independence unless they didn't have a lot of side effects from the stroke that they had.
Right, and so sometimes you don't even realize that until you're in that situation.
Correct.
Right, so
correct.
Of course.
And when you say that, I do want to bring up, we're doing these stroke series at the Holyoke Senior Center, and the thing that I'm kind of disappointed in is that the people that are coming have had strokes already and have gone through the whole process, whereas when I started dealing with this, I had no idea about, rehab facilities, the different type of rehab facilities, having people come in to care, for my loved one, having supports like occupational therapy, physical therapy, speech therapy coming into the home, social work staff coming into the home to try and work with everybody to try and navigate all of this, and it can be very, very difficult. And again, you're dealing with somebody who's very frustrated, very low self-esteem. They've lost all of their independence, and they just are not sure how they fit into things at this point.
And do you have therapies that are specific to stroke recovery? And what do they involve?
Not necessarily. I mean, talk therapy and medication therapy are always a good combination, and probably the best combination. And again, primary care physicians will usually prescribe and then refer to therapists, outside therapists. River Valley, like I said, has a ton of therapists, and there's therapists you can find through insurance companies. Senior centers actually are really good at giving you ideas about therapists for older people. So, you call your senior center to figure out who the person could see for therapy. But again, literature shows that a combination of medication and talk therapy. And if the primary care physician can't handle it, they might refer to the person to a psychiatrist. You know, there's a lot of other things besides depression. There can be what's called a pseudo-bulbar affect, where the person cries for no reason or laughs for no reason, and trying to get that under control, or have manic depression now, where they have periods of mania where they're talking really fast, they're constantly moving, they're having trouble sleeping. So there's medications for that. And those sometimes the primary care physician might be nervous about prescribing, so may refer that person to a psychiatrist or a psychiatric APRN.
Right, and so there's a huge mental health component around this as well. You know, someone who's endured a stroke. So, you know, talk about how you help somebody accept, you know, the circumstances now.
It's sometimes hard, and as a caregiver, like I said, it's interesting I'm having this conversation with you, because it's hard because you're trying to help that person understand what you're going through and help them understand what they're going through, and also help them understand their limitations. You know, my loved one, who's a nurse, is very frustrated, like trying to get her medications set up or trying to pay her bills, and still isn't quite there yet. So working with her and telling her, you know, actually, the other thing I would say is encouraging her to do those kinds of things, and, you know, sit with her and try and work with her so that she gets more independent. I think that's very helpful.
And so how important is it for, you know, caregivers who are emotionally involved and become overwhelmed with responsibilities for, you know, them to neglect their own health and their own well-being?
Absolutely. Absolutely. I was just thinking that yesterday. It's very overwhelming, like I said, running 2 different households and trying to make sure that everything's in place for this family member. And you know, there are places that you can go. You know, usually the senior centers in the areas have support for you, caregiver support. Highland Valley Elder Services in Northampton, Springfield Senior Services, Western Mass Elder Care in Holyoke. They have all have a lot of support for you around seniors and offering support and caregiver support. One of the hardest things I think right now is staffing shortage. Certainly, you know, trying to get some help in is a struggle with the staffing shortages. So you still need to rely on family members.
Right, and I was just going to say, you know, if the family is just really overwhelmed and you know, they reach a point where they're considering getting full-time help or moving the patient to a long-term care facility, you know, what are the steps that they can take?
Well, moving to a long-term care facility, you know, you just would have to make calls to those facilities to find out, and again, you'd have to find out what they would offer and whether or not insurance would pay. Certainly, insurance usually pays for a short period of time, unless you're on a Medicaid product. So a private insurance isn't going to pay, and commercial insurance isn't going to pay for as much. And then if the person has money, they would have to privately pay on a daily basis a rate for the long-term care facility. And then for in-home care, again, there are a lot of agencies in the area that offer in-home care. And again, it's expensive. You know, I have found this out recently that it's about $34 an hour to have in-home people to assist you with the person's care, and you know, that can build up financially as well. So if you don't have any money and you have a Medicaid product, you know, long-term care is usually paid for, but again, commercial insurances, or if you have money, it's not going to be. So you'd have to be thinking about those things, and it's just reaching out to these agencies and facilities to get, you know, what kind of information you can get from them.
All right, so a lot of things to think about.
Mm-hmm.
All right,
Yeah.
Thank you so much. When we return, we'll be learning about community support resources for stroke patients and caregivers. You're watching 22 News in Focus. You're watching 22 News in Focus, and today's topic has been on the diagnosis, treatment, and recovery options after a stroke. Depending on the seriousness of a stroke and how well a patient has recovered, some return home, but some may need some assistance. So joining me now to talk about community resources is Anna Randall, Community Service Director at Greater Springfield Senior Services. Thanks so much for being on the program.
Thank you so much for having me.
And so, you know, I wanted to have you tell us about your organization. When was it founded, and what is the mission?
So Greater Springfield Senior Services, we've been around since 1972, and our mission is really to provide services to our community that help people stay in their home as long as possible, but make sure that they have options and dignity, and they can make safe choices.
And what are some of the services that are offered?
Well, and since 1972, we've had a couple flagship programs. Most viewers will be familiar with our Meals on Wheels program, but we also have a subsidized home care program, which is one of the only programs for non-Medicaid people to get discounts on in-home care. And today we have almost 26 different programs in our agency. But one of the great things is that we're part of an aging network. So a lot of our services are available in any city and town across the Commonwealth at one of our sister agencies.
And so in terms of appointments, is it something that's done over the phone? Can it be done online? How do you go about that?
So we have a lot of different contact points. Certainly, I would recommend giving our information and referral department a call. We're open Monday through Friday, 9 to 5. And, but also we have online chat, we have email, we have different social media platforms where people can reach out and ask questions. So it really just depends on what they would like to do. But certainly anybody looking for services, information, or to make a referral can give us a call.
And do you have specific support services for stroke patients?
Not necessarily specific to support for stroke patients, but a lot of our services are going to absolutely benefit families and loved ones who've had strokes. So between in-home care, Meals on Wheels to give the caregiver a break, we have money management programs, Medicaid programs that can offer more in-home care. So it just really depends on what that person is looking for.
And what are some of the benefits to recovery and continuing to live in your own home?
I mean, certainly, I know when I'm sick, the first thing I want to do, is stay in my own home and be around my own things. But certainly I think anybody in my colleagues in the medical field will say, you get a better picture of somebody in their home environment, what services they have, what informal supports they have, what their comfort level is. So you just get a clearer picture about what they need when they're at home.
And earlier in the program, we talked about not all stroke patients being elderly, right? Mm-hmm. So it's happening people in their 20s and their 30s. Mm-hmm. Are your services available to any age?
It really depends on the service, but absolutely. And also the information is free. So our job is to know a little bit about a lot of things. Thankfully, in the state of Massachusetts, we have a lot of care programs. It's just knowing how to access those. So the state really wants to have a no wrong door approach. So even if we don't house the service that you might need, we're going to make sure you get the information to get to the agency that may provide that service.
Right, and so Melissa and I were talking about how important it is to have that family support, to have there be somebody, friends, anybody that can help you, but maybe there's a situation where you don't have that. So what are some of the services that would help somebody who's kind of going through it alone? Absolutely.
Unfortunately, we do see that, whether that's just people whose family live out of state or, they have a family of choice. And we wish we had a magic wand and there was one service that could help everybody. But to borrow a phrase from my colleague Brenda Labby, it's really a quilt of care. And so even if you have no family, we can help you piece together the services that you might need.
Yeah, and you've talked about, your Meals on Wheels services. Are there any other meal services available?
Yes, absolutely. We do support community dining sites for people that maybe want to get out into the community. But our Meals on Wheels program across the state, it's not just meals anymore. We make sure that we see the person, make sure that they're okay. And as kind of we see more incidents of stroke and heart disease, we've had to tailor our meals. So we have specific meals for renal patients, cardiac, so pureed meals for people if they've had a stroke and have some swallowing issues. So we have a lot of services that we might be able to provide.
Yeah, that's great. And so for the people that might need, some help advocating for themselves, filling out paperwork, things like that, are there caseworkers that help with that?
Absolutely. Depending on the program, you get assigned a case manager, but also we like to make sure that, again, we're an aging network. We want to make sure that we're connecting with our care partners, whether that's our partners at the Bay State or our councils on aging and senior centers. The outreach workers, especially in Western Mass, are fantastic, and they're often the first person that people call. So we want to make sure we're cultivating those relationships, but just in general to reach out to those entities so that they can get to us to get the services that they need.
And what about services for caregivers? Somebody might be, dedicated 100% of their day. Somebody might have to divide that up between work and their own family and everything else they have going on.
Absolutely. It's the unexpected career, right? A lot of the things that caregivers do we pay other people to do in our real lives. So we pay nurses, we pay money managers, we pay all that. And then when somebody has a stroke or another a medical issue, the caregiver takes all that on. So we really want to make sure that we are providing information and training. Greater Springfield, we're lucky enough to have a federal program called the Massachusetts Family Caregiver Program that can provide support specifically to the caregiver. Now, a lot of the services that we might suggest will obviously benefit their care recipient, but the caregiver and the case manager that's assigned to them, it's really what they need to be able to support. So whether that's giving them a scholarship for some mental health support, helping them get the healthcare proxy power of attorney paperwork that sometimes is a barrier. We want to make sure that we're providing them the services and the resources that they specifically need.
Right, and walk us through applying and if there is a cost for the services.
So specifically the Family Caregiver Program, there is no cost for that program. Some of our programs, there may be a sliding scale fee. Our federal Meals on Wheels program is a suggested donation, but again, we're a nonprofit agency. We want to get the services out to the people that we need. So the best advice that I would give would be to give us a call and see what might be available. Again, you might not be eligible for that service right now, but unfortunately, people with strokes might need, services down the road. And so just knowing where to get those services or what your options are down the road is a great first start.
And what would you say to an elderly or disabled person who feels that they have nowhere to turn? What would you say for them to get some help?
The first thing I would say would be, it's going to be okay. I know that it feels overwhelming and hopeless and stressful, but that feeling isn't going to last forever. And to absolutely give us a call. I mean, it will be a shock to you and your viewers, but we're not in this for the money. Most of the people, my teams that I work with, are caregivers themselves and do this to make sure that we're helping our community. So we are living it, we've seen it, and we might not have an exact service that you need, but we're here to listen.
And how can somebody learn more about Greater Springfield Senior Services?
Absolutely. So obviously you can give us a call Monday through Friday, or the best course would be to visit our website, which is www.gssi.org.
All right, Anna, thank you so much
Thank
for
you
your
for having
insight.
me.
And I'll have some final words after the break. You're watching 22 News in Focus. You've been watching 22 News in Focus, and today we've been discussing the diagnosis, treatment, and recovery options after a stroke. We want to thank all of our guests for joining us and being on the program today, and we thank you at home for taking the time to watch. If you missed any of the program, you can watch it in full on our website. That's wwlp.com. From all of us here at 22 News, have a great Sunday.